It is just a huge honor for me today to be podcast interviewing Dr. Ivan Chicchon, a prosthodontist and implant surgeon. After graduating from dental school in 2013 at University of the Pacific in San Francisco, he completed an additional 3-year residency at the University of Michigan, where he learned most of his advanced techniques for dental implants. He has published a popular book, the All-on-4 Handbook, which is a comprehensive, no-nonsense overview of the All-on-X procedure from start to finish. In the past, he has worked as a traveling implant guy for many offices and currently maintains a private practice limited implants. Above all, Dr. Ivan's favorite job is teaching others how to place dental implants and sharing his techniques and mistakes through his own company, Implant Ninja. Implant Ninja is the leader in online dental implant education, hosts virtual dental implant workshops around the world, and has comprehensive online courses that teach various aspects of implant dentistry. Ivan is passionate about teaching and connecting with other doctors. In his spare time, he enjoys arts and crafts and spending time with his beautiful wife and his 2 adorable daughters. Dr. Ivan has recently discovered a high interest in coffee and is exploring new brewing techniques. He is very excited about growing his own coffee plants. And that is so adorable because you were born in Lima, Peru, right?
Right. Yep.
And Lima, I thought was I think Peru was absolutely the greatest country ever because, a sugar and a carbohydrate are just carbon, hydrogen, oxygen. But for a protein, you need a nitrogen. And most nitrogens that we eat out of animals get it from the ground, but a legume extracts it out of the air. And every legume, whether it be a navy bean, even a peanut is not a nut. That's a legume, kidney bean. All your beans all legumes are found in one forest in in Peru. And if they didn't find that little forest, or if it, like say the Amazon forest got, all plowed under. But I mean, looking at what they found in Lima, Peru, and that rainforest, every legume on earth comes from there. And now you're into coffee too, huh?
Well, Howard, I actually have nothing to do with my bio, but yeah, I think it was put together. But yeah, that's just my team's view of me. So yeah, I've been really into coffee lately. I'm growing my own plants, and coffee is really hard to grow. Actually, those things have almost died on me like 10 times already. But anyway, yeah.
So you're growing coffee in Stockton, California?
31 plants in my house.
Oh, inside, not outside?
Not outside, because right now it's cold. It's not like sunny Santa Monica, California. It's
so when you drive into San Fran, how they got that mountain with the really tall cell phone tower?
Yeah.
You know what I'm talking about? My boys, I got 4 boys. The 2 of those boys have lived on that tower the last 2 years. They're cell phone tower operators, and every day, and it's funny because you think of being on the beach of California as this great weather, and oh my God, they're always getting rained out, fogged out. I mean, it's crazy times. But man, thanks so much for coming on the show. You're a legend in implant dentistry. I've been trying to get you on the show for years, and the reason why is because dentistry was started, in France. Pierre Fauchard, 200 years ago, the first barber surgeon to say, no, let's just do dentistry. And he wrote a textbook. 100 years later, we had our GV Black. It's a very old, mature industry that pretty much grows the same rate as inflation. The only 2 areas that are growing double-digit are implants and clear aligners. So if you get out of school and you got $400,000 in student loans, doing cleaning exams and x-rays for the PPO fee schedule, it's going to be hard to pay the bills. So you're going to have to kind of go soft and pretty, bleaching, bonding, veneers, Invisalign, clear aligners. Or you're going to go blood and guts, and someone comes in with a toothache, you got to extract a tooth, do a root canal, place an implant. But a lot of people are scared. So how do you coach young, scared dentists who are afraid of blood and guts?
Howard, this is it's a big topic, right? I like to teach implants, but I think that the topic that's even much bigger than that, right, is the pressure on young dentists now coming out of school. You said 400,000. I mean, that's not even the highest, right? I graduated from dental school, and I already owed 400 plus. Then I went to Michigan and paid for my pros residency. So by the time everything was said and done, I'm looking at close to 800K, and I'm not the only one, right? And so you feel really pressured, and like you said, you have to either go the veneer fancy route or the big bloody implant stuff route. Either way, it's like patients with very high expectations. And so here you are as a young dentist owing a lot of money and doing work under pressure. And so that's a really hard spot to be in. So I'm not necessarily out there to just teach people implants. I also really sympathize with the journey of, having a, I guess, a difficult time in the early years of your profession compared to somebody maybe like when you graduated, you didn't have that same pressure. Is that right?
Oh, I got out of school $87,000 in student loans. My dad paid for my 5 sisters to go to college, but since I was a boy, I had to pay for my own. I'm sure glad I'm a boy. And but I was $87,000 in student loans back then. But back then, you would just bill Delta, and they would just tell you what percent they'd pay. So if I charge $1,000 for a crown, they pay half of crowns, dentures, partials, 100% clean. It was all my own fees. They just paid 1%. It was easy money. But then when they switched to, no, we're going to give you the fee schedule. My God, stuff got competitive. But I got to give you a credit. One of the biggest implant legends I know is ML Verbin, who came on the show. And he always tells people, and they say, well, I'm interested in implants. He always says, well, I would suggest you purchase the All on X Handbook by Ivan Chicchon, the Implant Ninja. But I mean, to get an endorsement from the man, I mean, that's damn impressive. How much did you pay Emil to say that?
I can't say it. No, I'm just kidding. That's amazing. The cool thing about that was that it was just it's purely organic. I have nowhere anywhere is there like a landing page or promotion or paid ads for the All on X Handbook. It's actually kind of buried in my site somewhere, and nonetheless, we still get a lot of orders every week.
Well, let's get some more orders. It's where do you recommend them buying it? On your site, implantninjaedu.com, or on Amazon?
Honestly, if you just Google All on X Handbook, there's a link right there. Don't get it on Amazon because that's not the right version. So I self-published because Amazon was very particular about the kind of pictures that go onto it, and they have to be a certain size, resolution, whatever. So I decided just to do it all myself, and it's totally self-published. So it's just you just Google All on X Handbook, and the website it takes you to is implantninjaedu.com. That's where we sell our books.
Yeah, and my gosh, Jeff Bezos, he has enough money. Isn't it funny? Even after his divorce, he lost half of his money, and his half still makes him like the one of the rich men's. So Implant Ninja EDU. So where's the ninja come from? Were you a Marvel comic book fan when you were a little kid growing up, and you love ninjas?
Of course. Oh, I like the Teenage Mutant Ninja Turtles, right?
Is that where it came from?
Oh, no, it didn't. So I was in my Prostho residency, and in my residency, I knew that I needed to learn as much about implants as I possibly could in school, because once I get out, I'm gonna get stiffed by an implant course because it's so expensive to learn. So I negotiated with my program director. I said, hey, I want to spend 2 days out of the week with the oral surgery guys. And those guys were trying to convince me to do oral surgery. I was definitely interested in doing oral surgery as well. And they said, if you do oral surgery and prostho, you're going to be a total implant ninja. And that just kind of stuck with me. I made my handle right then and there back in 2016. And early on, there weren't too many people posting bloody implant stuff in the beginning. So I guess it was kind of easy to build an audience early on.
Well, one of my pet peeves is that when you I always say success is transparent. You don't need to be really smart or reinvent the wheel. I mean, this is dentistry. It's been around for 200 years. If you can't figure out how it works, you're not looking. But when you look at DSOs are a great model because they're transparent, and those guys come on the show and they say what they're looking for and what they're doing. But the bottom line is when they open up a practice, let me pull it, make sure I'm going to say it exactly right. But when they open up a new practice, if it's not doing at least 7 root canals a month, they know they can hang on to it for 1 year, 5 year, 10 year, 20 years. It's a bust. And their successful practices, they're all going, except for Aspen, which goes in the lower economic because they got a denture clinic and a lab man for relines and all that stuff. But all the other DSOs are targeting the rich suburbs that have $60,000 a year median household income or greater. And if they're not doing 7 root canals a month and extractions, They do the greater full theory and try to unload it. I mean, like Tesla. I don't care how high that stock is. Right now, the Tesla stock is worth more than all the other car companies traded. I mean, Ford, Chrysler, GM. I mean, if you think Tesla's worth that much, I don't know what you're smoking, but I don't think they sell that legally for weed. I think you're on LSD at this point. But it's called the greater full theory. You could find the dumbest guy on earth today to sell your Tesla to. They're just that dumb. So if they started DSO de novo and they're not doing root canals 7 root canals a month and extractions, they unload it. And then I got these kids that come out of school, $400,000 in student loans. A root canal is $1,000. You don't have to sell it like bleaching, bonding, veneers. They come in begging you to do it, or an extraction. And a lot of these young kids are like, they did one molar endo in dental school, and they're like, I'm not doing that again. And they place one implant, and it fails, and they're not doing that again. And it's like, my God, do they think Mike Tyson just knocked out the first guy he ever punched? What would you say to these kids? Like, I'm seeing half the graduating class is already done with implants and extractions and endo, and shit, they haven't even started yet. What do you say to that guy? Talk to that kid.
So to be completely frank, placing an implant in a site where you have enough bone, a site that's treatment planned well, right? It's easier than doing a class 2 filling. Right? You're doing class 2 filling, you get water sprayed in your face, you have to it's really, really up in there. It's super, super small zone. But with an implant with a lot of bone, it's really, really simple and straightforward as long as you're safe. So what I would recommend is taking baby steps. You just got to baby step it from the beginning. If you try to bite off more than you can chew right with the first case, you're going to get scared, you're going to get a failure, and then not move forward. And that's something that I see a lot, actually. People that are taking my courses, and I'll help work up one of their cases, for example. And they'll say, hey, in my first case, I want to do a full mouth extraction, do 4 implants and immediate load. My first time doing that. So instead, what I advise is, why don't we do it in phases, and you'll get super comfortable, right? Do the full mouth extraction first, get immediate dentures in, do the implants, don't load them right away, and then do the full arch restoration. So doing baby steps, everything's easy, right? You can there's a lot less to troubleshoot. So I'd recommend doing baby steps. That way you don't get scared off.
Another thing that I love so much about you, your book, everything about you is when you go to the big dental meetings, the implant course are all like the all-on-4. It's like, are you out of your mind? I mean, first of all, the all-on-none, a denture, the average dentist is going to do 99 all-on-nones for every all-on-4. I mean, what the hell is that at the deal? And and all the teachers, they don't want to teach dental kindergarten. I'm going to place one implant on a maxillary second bicuspid. They're like, no, I'm here to show off. I have no self-esteem. I'm going to try to make you feel inferior, and I'm just going to show all on 4 cases. The deal is they got to start as a baby, and they got to. And I wish there was a lot more all on. And by the way, the greatest implantologist that I ever got to see, and I'm sure if I live long enough, you'll be like that guy, was Carl Misch. I mean, when I first met him, I wanted to yell at him because he had a general anesthesiologist. He had 3 people under, and he's sitting there and he's placed the implants while he's looking at me talking the whole time. And I'm like, look in the mouth. He's got them all flapped open. And I felt like, how you're in the car and you don't want to talk to the driver because every time you say something, they look at you to answer and you just want them to drive. And I look at these guys and, that's Beethoven playing the piano for 30 years. These guys got to start with 1 implant. The next question they ask is they're Americans, so money's the answer. What's the question? Is it seems like all the implant training is tied to a dental implant manufacturer, so they almost figure I got to pick the system first. Are you agnostic, or do you is Implant Ninja primarily one system?
So the only way that Implant Ninja is successful is if I'm implant agnostic, right? Like you said, every single training system is tied to an implant. And that means that for better or worse, they're slightly biased towards a system. I've worked with companies before, and after a lecture, they'll tell me, hey, how come you mentioned Blue Sky? Or how come you mentioned Neodent? Or how come you mentioned the other guy? Try not to say this or that. Why don't you say that you would place this implant on your mom? They literally said those things to me. And so implant companies do try to, pigeonhole you to their system. So I try to keep mine totally implant agnostic. That said, I've had some frustrations with finding a system that really values the customer. And so I decided to build my own implant system. But, my courses are so agnostic that my implant system is not even in the course yet. And I don't plan to guide people towards my system. So just got to keep it totally transparent, no BS.
So what is your system? You mean you're making your own implant?
Yes. So I saw that you had one of my role models on the show as well, Jerry Nisnik.
Oh, yes.
So I knew of Jerry even when I was in dental school. I was trying to decide what I wanted to do, and I saw his career path, and I just thought that was totally amazing. For those of you who don't know, Jerry is founder of Implant Direct, and before that, Corvent, just like an implant genius, I think. And so I've always kind of kept that sort of in the back of my mind, and I'm sort of systematically blazing the trail. Right? I started with the X Handbook, expanding to my online implant training with basics and more advanced, and now starting my implant system.
Now, have you talked to Jerry about your goals?
Yeah, I have. Yeah, Jerry's a super cool guy. I've connected with him a few times on FaceTime, and he's actually out of the implant game right now because he sold his company, so he actually has a non-compete. He can't actually advise anybody on stuff, but we just shoot the breeze. And so much pearls to pick up from him.
Well, he lives in Palm Springs, and I only have a few friends that when you want to go to lunch, they pick you up in your jet. One was, you can count all those friends who pick you up on a jet to go to lunch in one day, but he's in Palm Springs, and that guy. So he was making titanium implants, but his engineering mind, avionics things was far more complicated. And I think he just left dental implants to go do aviation things. I don't know if I don't know if he'll get back in it, but just an amazing man. But guys, I mean, all you got to do, you're already in California. All you got to do is go down to Palm Springs. And in fact, if you ever want to meet me there, I'm 4 hours from Palm Springs. We should, how long did it take you to drive to Palm Springs? Or would you fly?
5 hours. I'd probably fly.
Yeah, well, if you ever want to go have lunch with Jerry, I've never not learned a million things. That the guy just doesn't stop. I want to go back to your book. The first thing you talk about is the things that the kids don't even know that's a thing, and that's step-by-step instructions on treatment planning. And my gosh, treatment planning, I mean, think about it. They're in dental kindergarten school. They just learn how to make one tooth. When they come out of school, it takes about 5 years before they think, well, gee, if you're going to be numb on that whole quadrant, might as well do both fillings instead of one. So it takes 5 years to go to quadrant. And then about 5 years later, they say, well, hell, if I'm going to numb your lower right, might as well do the whole right side. And then they never do go to full arch, like the oral surgeon is in the same building, and they're numbing up all four quadrants, all for this. Now, I know I when I say that, someone's always going to email me and say, hey, you can't do full mouth restorative because the occlusion's off because there's too numb in their bite. But my gosh, one of the fastest ways to get to success is get your mental didactic brain treatment planning ahead of your surgical hands that haven't learned how to play the piano yet. What do you agree that treatment planning is just the most fundamental important part of the whole thing?
100%. And I mean, that's, not even just talking full arch, but actually the All in X Handbook, just because you brought up the All in X Handbook, was sort of born back in dental school when I asked one of my instructors who's a prosthodontist, help me treatment plan this case. And he said, oh, it's easy. Just go on YouTube. He told me to just YouTube it. And at that point, there wasn't an Implant Ninja YouTube channel, right? That it really was more marketing on YouTube about the all-on-4 stuff than really step-by-step treatment planning. So from that point all the way up until I published it in 2016, I'd been kind of like putting together piece by piece how to treatment plan this thing and how to explain it in a really step-by-step way.
Yeah, you just need to learn the treatment plan part. But I'm curious about back to your Nizik deal, where you're thinking about making your own implant. Are you going to outsource that to an implant company, an OEM, an original equipment manufacturer to make the titanium, or are you going to mill them yourself, or what's this journey going to look like?
And so a lot of this is, keeping it close to the chest, but something that, like, I guess something that I'll say is that, and not many people know, a lot of the implant manufacturers don't make all their own stuff, right? Everybody thinks that they do, but they don't, right? And implant manufacturers even share a common manufacturer, right? They might get different parts from the same machining shop, right? And so, yeah, I'm not making them in my garage. I am sourcing them. I'm not sourcing them all from one place because I'm really trying to find the parts that really make it super convenient for the dentist. Right now, if you look at an implant catalog from any of the big companies, or actually any company, that catalog's 100 pages, right? It's got 1,000 items on it. I'm whittling it down to like 20 items. So I'm just trying to keep the buyer experience in mind and really tailor it towards making them successful versus selling them a big package, right? That's what I felt in the past. Like, these guys are just trying to sell me a $10,000 starter kit, and then they bail, and or they change to another implant company. That guy's not my rep anymore. I have had great reps in the past, but it's never consistent. It's too rep dependent.
And what you say has a lot to do. You can see it in M&A activity. Like, I remember 3M way back in the day, they bought Espy, and which made the Impergum I used. And I remember asking them, well, what do you like the most about Espy? And they go, well, they're the ones making all the stuff for all my competitors. And they start naming Discus Dental and all these deals. And we would like to just buy them and cut off their, they're because they're making it for everyone else. Like digital x-ray sensors. I mean, I feel bad because I own a media company. I own Dental Town magazine, and it makes me sick when I see people advertising about how, their equipment's better than a competitor. And I'm like, okay, you guys both buy from the same company. I mean, VCRs. I read a deal about 2 or 3 years ago that planet Earth is down to one VCR factory in Japan. So if it says GE or LG or whatever, there's only one place on Earth that'll make a VCR anymore. So how many different companies on digital X-ray sensors? There's not many companies that make a digital X-ray sensor. Did you know? Have you heard that?
I actually didn't know that, but I know it's pretty standard. Like, for example, with bone graft in particular, bone graft, you'll see a big implant company A and big implant company B, they use the same bone graft suppliers, slap their sticker on it, and then they say that theirs is better than the other guys because of, reasons X, Y, and Z. So I think there's a lot of that sort of misinformation through marketing that I'm really trying to cut the BS with my company. And our implants are not publicly available yet. We're keeping it a small cohort at first to really nail the customer experience. But I'll be sure to announce when it is available.
Well, before you start testing them on mice and rats, you can put one on me. Okay, I'll drive up there. I'll see my boys. You can say, well, your dad was the primordial step before we get to mice and rats. So how many implants should, well, first of all, do you agree that you just start with placing one implant at a time for the first 100 or more before you start treatment planning? I mean, I would think somebody doing an all-on-4, I would hope to hell that's at the end of at least a 5 or 10-year journey, isn't it? Or not really? How long is it between you place your first implant, and which would be the easiest starter for the young kids to try? And then how long would be normal before you're an all-on-4 guy?
I would recommend starting with maxillary premolars or mandibular first molars, right? Those are piece of cake. If you find the right case, piece of cake, and then move on to multiples, I guess. You can move on to immediates, but really, really baby steps. How long does it take? I don't really know. I guess it depends on the person's previous experience. For example, in dental school, my fellow students didn't want to take on big cases. They didn't want to do any implant cases because it didn't fulfill requirements. And so I actually didn't really pay attention to my requirements, and I just took on all the implant cases. And so I was able to get a lot of experience early on. So when I graduated prosthodontics, I already had cases lined up back here in California. I was actually flying back and forth from Michigan to California doing big cases in my office. So it really just depends on their experience.
And what I want to recommend is I got sidetracked on that Carl Misch deal is that Carl Misch got into he was a prosthodontist doing all on nuns first. And then the only reason that implants got his attention is because at the school, I think it was University of Pittsburgh, they were showing these implant cases that failed and they were blaming it on the implant. And he's looking at it and saying, well, this is the worst denture. It doesn't have the right bite. The forces are all wrong. And again, 1 + 1 = 3. He was a prosthodontist and nailed a all-on nun denture first so that the implant was augmenting it, not screwing up the denture, a horrible bite, all the forces was wrong, and trying to save it with titanium. And, so I see that all the time where, a dentist will say, well, I don't want to learn orthodontics because I'm not going to do into orthodontics. I like root canals. I like my extractions. I like blood and guts. I don't want to learn ortho. Okay, bud, but the mom's going to bring in her kid and says, well, my baby need ortho, and you don't know ortho. And then what I don't understand is how are you doing TMJ and occlusion and think you're a TMJ occlusion guru, and you can't do a simple orthodontic case? Because when you start doing simple ortho cases, it makes you rethink about half of your TMJ lecture stuff. I would beware of the all-on-4 guy who can't make a denture. I would be very wary of the TMJ expert who's never done a class 1 ortho case. And, cross-training is everything. I think so. Does that make sense?
It makes perfect sense, and it kind of comes back to the point that say you use a Nobel screw and you use a Straumann screw, and it's not both of those will work, right? If you get a failure, it's not going to be most likely because there was something wrong with the screw design, right? It's most likely coming from somewhere else. Any failure, I would say, it's just due to some clinical decision that you made, maybe, or a patient decision that they didn't take care of their implant, or you put too much pressure with that denture, right? So the failures are not going to be coming from the implant itself, I think. Most of them anyway.
You almost can't, you really, nowadays, it's funny because when I got out of school in 87, and back in the 80s and the 90s, every single person who ever placed 10, 20,000 implants did it on a 2-dimensional pano. And now they say, oh, you have to have a 3-dimensional CBCT. Dude, I'm so old. I remember the greatest upgrade on the pano machine is when they did the software upgrade that put a R on one side of the pano and an L on the other. And I still think that's the greatest thing that ever happened in digital radiography. I mean, because every patient's like, that's my right side. But now everything's digital. And the complaints on this show, besides I always talk too much and never let my guests talk, is always I'm not making my guests, I'm not holding their feet to the fire to name brands. So digital workflow, I'm sure with as young as you are, you're all things are digital, and you don't use a pano, and you're not even impressed with the R and the L anymore. So what is your digital workflow? But name specific, like what software, how would they set up a digital workflow?
Sure. So we have a cone beam in our office. So I work at a family practice. So my family started this practice 20 years ago. They have a cone beam machine. So that's what I use. It's a J Merita. And for all of my implant cases, pretty much all of them, we take a cone beam and I work it up, not in that native software. I actually take it to Blue Sky Bio. I really like their free software. It's pretty robust, and you can export, you can work with all of your, I guess, other third-party softwares to print your own guides. So I use Blue Sky Bio, I use Mesh Mixer, and using those two, I'm able to...
Mesh Mixer, is that from Blue Sky Bio, or is that a third company?
Mesh Mixer is from Autodesk. I learned how to use it back in dental school, and it's really handy for just messing with 3D files. It's almost like a new skill set that if you want to get into digital stuff with implants, you have to learn how to do 3D modeling and sculpting. And so that one's pretty easy to use, and there's a lot of resources on YouTube for it. But I use those two along with a 3D printer to make guides when I use them.
Okay, so I'm slow and not all that sharp. So Jay Marita is your three CBCT.
Hmm.
But by the way, you said it's an old family practice. Is Edwin? Is that your dad, brother, cousin? Who's?
Edwin's my uncle. Yeah, so I come from a family of like a dental family.
Well, tell Edwin I said hello. Me and Edwin know each other. So he's got to be he's damn near as old as I am. I'm 58. How old's Edwin now?
Probably around that age, yeah.
Yeah. So he's still alive? Tell him I'm shocked he's still alive. So you recommend Jay Marita for your CBCT. Now, is that standard of care? What if they only had a pano? Is that no longer good enough? Or what would you say to that?
I'll tell you what, for probably 2-3 years, I worked going practice to practice. I was like at 10 practices, and obviously not all of them have cone beams, right? I would go in and I would just be their implant guy. Pano works just fine. A pano with your thumb and your index finger for feeling the ridge works just fine. You know, people did it like that for decades. I don't think that it's not reasonable to treatment plan that way. But yeah, if you get sued, sure, I'm sure someone's going to find a reason to fault you for not using a cone beam. When there are cases of limited bone, I like to use a cone beam. So I used to refer them out for a cone beam in those cases.
Okay, I want to go back to Blue Sky Bio, and that's Blue Sky Bio is Sheldon Lerner, dentist, but talk about Blue Sky Bio. First of all, the kids in dental school, they don't even know what it does, and then the older ones want to know, well, why do you like that one?
Sure, I started using Blue Sky shortly after I graduated, I think, and I used it, well, first of all, because it was free. And second of all, because I was able to find a lot of resources on YouTube about how to import models from third-party software, from MeshMixer, right? So it was very easy to interface with other softwares. I still use it because I'm used to it, and I feel like it's very robust if you want to go beyond what other softwares kind of restrain you to. So if you're using like the Jay Marita software, Anatomage, they're not designed to let you experiment. They're sort of designed to just get you to do the basic stuff that you do on a regular basis, and that's it. But Blue Sky, there's a lot of extra stuff you could do with it.
Okay, and is MeshMixer free software for making awesome stuff? Is that meshmixer.com?
That's right.
Okay, and what is MeshMixer?
MeshMixer is a software that allows you to manipulate any 3D model. So if you have a scanner in your office and you scan something and then you just save it as an STL file, you can, on your flash drive, transfer it to a MeshMixer, and you can open it up there and manipulate it any way you want. So for example, if you scanned your patient's teeth, you can open that in MeshMixer and make a 3D model that is then able to be printed.
Nice. And do you gosh, man, I have so many questions. I'm going to try to stay focused some way. So on the digital workflow, is it all digital? I mean, did you get rid of polyvinyl siloxane, polyether? Are you doing a scan with like 3Shape or something like that, or are you still old school using vinyl polysiloxane?
Well, I'm a really artistic guy. I like to do things with my hands. I've been sort of resistant to doing everything digital. I really like to do things analog still. So yeah, I still use PBS. You need to use both, right, to be successful. So your scan's going to help you, but you still need to know how to take a really good impression, right? Like for dentures, there's nothing better, I think, than a really solid denture impression.
Interesting. Okay, so then let me go back. Restorations. I'm hearing some bizarre stuff that says things like well, the zirconium is too hard, it's too soft. Everything in my mouth is gold. But I'm old, and then gosh, I can't believe the new thing when I was in middle school is the PFM, where they were painting porcelain to gold. And I didn't think I'd live long enough to see that go extinct, and now it's all zirconium. So is zirconium too hard for implants? I mean, you already don't have a periodontal ligament, so you already got titanium fused to bone. Now you're having zirconium with no give. Does that set well with you? Is that okay, or does that concern you?
So even though zirconium's like the go-to thing now, honestly, the most beautiful things that I've seen is the old school restorations, the older stuff, PFMs with hand glazed porcelain done the right way, or even if you have a ceramic coping with porcelain on it, with porcelain hand layered on it and then stained. That stuff's the most beautiful stuff. I feel like now there is the laboratories are, how do I say it, Howard? Laboratories are merging together, and the small labs are just not able to compete as well with the bigger ones. And so the bigger ones might be able to chug out more affordable crowns. You get a crown for $40, but really, I don't think that competes with the CDT, right? The technician that really spent hours making that crown beautiful. So it's hard to compare, honestly.
Right, it's not apples to apples. And here's one of my big problems. I'm out here, you're in dental school and they're telling you, well, and when you're a treatment plan, you need a health history, and you don't want to put this in smokers and drinkers. I mean, they might as well just ban all dentistry from the Irish. And you gotta pick this person. Well, the person that needs a bunch of teeth extract and implants, it's not your yoga instructor. She didn't fall down on her way to go buy tofu. I mean, I'm out here in Phoenix. They're drinking, smoking, cussing. They come in with their pack of Marlboro right in their pocket. And then these kids are taught that all those people can't have implants. And it's like, and then when you're treatment planning, of course you wouldn't make it fixed because they have no home care. So you would want to snap on so they could take it off and rinse it off and all that kind of stuff. But oh, hell no, that same bumbling Irish drinking, smoking crazy man wants it fixed. And then the next time you see him, he's got half a filet of fish sandwich stuck underneath his implant bridge. It's like, this is a crazy party. So, the people with no home care need the most dentistry. And those are always the ones who want their restorations fixed so they can never be clean. So how do you wrap your amazing ninja mind around that whole dilemma?
So the first thing I think, Howard, is that I keep in mind that the patient doesn't dictate treatment, right? If they tell me they want something and the other dentist down the street said they're going to do it, well, go over there because I'm doing what I feel comfortable doing. And on that note, actually, I do turn patients away fairly regularly. I like to screen because I like to sleep well at night, right? I did have one patient, though. I was doing his all-on-4 procedure right in the middle of it when I'm fixing up his teeth, right? I already pulled out all his teeth out. I placed implants. I sutured up, and now I'm fixing up his temporary in the lab. He steps out to smoke. And because I told him not to smoke, what he did was he stepped out. He's just getting some fresh air, and he put the cigarette in his nose, and he smoked through his nose. He's like, "Oh, don't worry, I just sucked it in through my nose, so don't worry about my mouth." So I don't know. Patients are sometimes non-compliant, but I don't let them dictate the treatment. And as long as I really get all those risk factors up front, I'm able to warn them ahead of time. Then it's not my fault. I told them ahead of time, right? But I just try to help them along the way, though.
That is so hilarious of a story. I always tell people, I mean, I don't know what it is to me, but like my favorite patient is this lady that comes on an electric wheelchair, and she's the last person that needs electric wheelchair. She should be walking more than anyone, and she's on oxygen, and she smokes by my front door until the very last second, and then she darts in the dental office. And I mean, I just love. I mean, she's just, I just love these people. We're all a little bit crazy, some more than other. So you're telling them, and this is so important because when you first get in over your head and you get in trouble, the number one diagnosing, like people say, well, how do dentists get really in trouble? Well, they get really in trouble because the way the human mind works is when you're walking through the jungle and all of a sudden a tiger jumps out, you don't have time to say, I wonder if that's a herbivore or omnivore. Well, I noticed it's got sharp canine teeth. I don't think it's a herbivore. I think it might, you'd be dead. So the way the human brain works, it just rips through everything in a second, and that's your intuition. But people don't listen to the birdie on their shoulder. And the birdie on the shoulder says, oh, I'd never do that. And then the older patient who's manipulative and loud talks you into doing something you would never do. And then you get in all kinds of trouble. Now, old school warriors know I'm not going to do a battle that I don't want to do a battle with. But when you're young and your intuition, and you know this from school, you can't be a dentist without knowing that you put the right answer there. Then you start thinking and turn your pencil over and erased it with the little eraser and change the correct answer that your brain did instantly and did the right answer. So just don't do things. And it's kind of like what I tell my boys for ethics and morals. And they'd say, well, why is this legal? And I always tell my boys, hey, if you have no problem with this being on the front page of the Arizona Republic tomorrow morning, do it. But if you don't want that to be on the front page of the paper, then don't do it. So
I want to say it's I am a little dogmatic sometimes. If a patient tells me, oh, well, can you do it this way this time? I try not to. I try to follow my protocols because I know what works in my hands. And it's easier to do something 100% of the time than it is to do it 99% of the time, right? If you have to actually like think about, oh, should I do it this time or not? Should I stick to my guns this time? It's really a headache. So I try to stick to what I know how to do and what I'm comfortable doing.
And so you have two books. You had the Implant Ninja All on X Handbook, and now you have the second edition. And when it says what's new in the second edition, you say new time-saving restorative workflow, new zygomatic implant walkthrough, updated complications management, how to calculate restorative space, trefoil all-on-3, revised mechanics chapter with John Brunsky, added pictures, illustrations, diagrams. So walk me through that. What is the new time-saving restorative workflow?
It's basically a cookbook, right? It's a cookbook that includes the lab slips that I write. It includes, well, actually, sorry, I actually forgot for a second. What that new workflow is just taking their temporary and making a mold of it, right? Making a mold of their temporary and being able to scan that, send it to the lab and get it milled back. So it sort of saves you some time in taking new impressions and verifying those impressions and the trying again. But basically, the book provides a cookie cutter approach to getting the prosthetics done. Howard, I don't know how we are on time, but there is something that I wanted to mention, if that's okay.
Yeah, the floor is yours, buddy. This is all you.
So there's something that I did want to mention to recent grads, and it's because I had such a hard time as a recent grad with big debt. I wanted to mention that, if you do what everybody else is doing, you're probably missing out on good opportunities for yourself. And so you should try to find, I guess, what works best for you personally. And an example of that is, I remember in dental school, everybody would attend biochemistry and then fall asleep. They would be in the biochemistry lecture sleeping. And I just didn't see that as a very good use of time. You shouldn't be, wasting your time sleeping. Of course, you want to learn the biochem material, but you can just get the notes later, right? So during that time, I would go and walk around the school and just look through windows and see what else there is. And that's actually how I connected with the guy who taught me how to use Mesh Mixer and how to do 3D modeling. And that's how I connected with other instructors who guided me during that time. So I guess if you're looking for a job, and another example, right? If you're looking for a job, most people will just Google it, just go to Indeed and see what's available and take the average pay. But when I graduated, I was in kind of a unique situation. My daughter was going to be born with this congenital malformation that, she was going to be very unstable, and I didn't have a job. And so I needed to have a job that would pay higher than average. And so the way that I found my uncommon job is I took out lab technicians to lunch. And finally, one of them told me about this one doctor who needed help implant troubleshooting. And that was able to connect me with a really, really cool opportunity. So what I'm trying to say is, for recent grads, really look for the uncommon opportunities, even though people are normally doing this or normally doing that. Doing something that's a little bit uncommon or weird I would say is usually a better opportunity for yourself. That's it, Howard. That's my rant.
Are you still good on time, or you got to go?
Oh no, I'm good.
Um,
Get that out.
so some people, I grew up. The sister younger than me is special needs, and she's my everything. Kayleen. Some people, that burden, they can't handle that burden. How did you what was it like for your journey to have a special needs child? How did you approach that, and what did you learn from that journey?
Howard, this is huge. This is the biggest thing that I deal with in my entire life. If my job takes 10% of my energy, being a parent takes 90%. It's insane. Okay, so we were actually told to terminate my daughter. We chose not to. We found some doctors that were able to deliver her. She was delivered through this crazy procedure, cost like $2 million. Luckily, insurance paid for almost all of it. But when she was born, we would have to make frequent emergency visits. So, spur of the moment, she would swell up in her neck and her floor of the mouth, and it would obstruct her airway. And so I had this little device. I'd have to stick it in her mouth and pull her tongue down, and we'd hop in the car and just go to the ER. And it was scary, man. It was really scary. And so I would frequently have to leave the clinic too, right? So I'd be in the middle of taking an impression. Oh, gotta go. So I would just get in my car and go. And so I ended up just taking 3 months off, or more actually. I just decided to quit my jobs and just stay home. I had to keep making my loan payments somehow, but I decided to just take that time helping my wife watch her. And at night when the baby was sleeping, I would stay up and write my book. So that's how I actually made the All in X Handbook. And by not being able to work with my hands during some periods of time, or not being able to work a regular schedule, that's how I found that I can actually make a living and have a lot of fun this other way. And that it was actually a better return, right? It's not like I was able to get a better situation where I'm not trading my time for money. Instead, I'm just creating and having fun. And yeah, I don't know, that supplemented my life so much. And now to the point where I'm able to work and be a very involved dad too. But this is huge. I'm dealing with it now. It's crazy.
The CEO of Microsoft, Satya Nadella, who's taken Microsoft to the next level. Every time they ask him, well, what do you attribute all your success to? And he says, well, my son Zane, who's now 21, got tangled up in the delivery and has cerebral palsy, and my wife and I had these big careers, and then this happened. And he said that looking back, that's what grounded us. That's what made us real. And I just think it's a beautiful thing that this is your main challenge is your child. And so that's what the Microsoft CEO Satya Nadella says, the same thing. It really makes you grounded. You'll always be tethered to the reality of humanity.
I think that, I'm still dealing with it, right? She had a neck resection last year. Neck resection. We actually moved to Seattle to have her neck resection. She had so many post-op complications that we just stayed there. And so it's made my work time, my clinical time so limited that really, I guess, the main piece of advice that I would give any young grad is kind of looking at this from a big picture perspective, is that resource allocation is probably the most important thing you can really get a hold of as far as my life. Resource allocation is the most important thing, because I realized that if you have less time to work with, you have to make it work in that time. And it's just worked out as long as I know that.
Man, you need to go to Microsoft to meet the CEO, because you went to Pro School in Michigan, right? Mm-hmm. He had to leave Microsoft with his wife and go live in Michigan for a doctor there. And then when he was done, they found that the best school for the child was in Vancouver or Canada, so they moved there. So he took a job at Microsoft because he could just come down from Vancouver. You guys are you guys should start a mutual admiration club with each other. I'm embarrassed to go from something that important all the way back to silly dentistry, but I want to go back to dentistry on a couple of things. On the implantology section on Dental Town, I mean, my God, there's 19,000 threads under implants with over 250,000 posts, but we had to separate implants and mini implants because every time somebody would place a mini implant post, everybody's, you should have not have done a mini. And it's like, dude, we're past that. You know what I mean? It's the same thing with the CERAC users and the E4D out of Dallas, Texas. My friend Basil from South Africa started. You know, every time somebody would show an E4D case, all the CERAC would have to say, well, you should have bought a CERAC. It's like, dude, he already paid $100,000 for the machine. You know, that's not what we're talking about. But I want to get the Ninja's thought on this. Is there any place for many implants? It sounds like, you know, it's kind of like religious extremism. There's just implantologists that think many should be erased from Earth. Even 3M got rid of their mini implants. I mean, big 3M. So the first question is, we had to separate implants from mini implants. Is there any place for mini implants, or are you of the camp that they should just be gone?
It's kind of like tools in your garage, right? If you just happen to have the right tool, you don't use it that often, but it comes in handy sometimes. I think it makes sense to keep some. I mean, some people are dogmatic about, no, if the ridge is too thin, you have to graft. That patient needs to be paying $10,000, $30,000 for a whole ridge augmentation. But, you know, if my patient doesn't have a lot of resources and it's a little old lady and she's got a small ridge, I think minis work great sometimes.
Nice, because it sounds like you're a thinking man and you're not an extremist. You can actually think. I'm sorry I have to ask you this, but they're always gonna ask, well, what implant do you recommend? I mean, she's driving to work. She's gonna start placing implants. When is your implant gonna be for sale? When can she buy them from the Ninja?
We're going to start taking our small cohort of early users in about 2 months. That's what I'm currently using right now. That's what I'm using right now. We're already having people using it, but I'm not opening it to the public yet.
And are you going to do the 80-20 rule where you're going to just make the basic, you know, the not the implant for every occasion, but you know the focus inventory? Is it going to be like Niznik? What Niznik did for younger kids is, when I got my fellowship in the Mish Institute, my diplomat in the International Congress for Implantology, now remember, I got all these accolades before they even invented a CBCT. So, you know, I'm sure if you saw any of those implant cases, they look like cavemen stuff. But, you know, but back in the day, you know, it was far more primitive. But you're right. We take a pano, and I remember thinking I had an inch of bone. And then you lay the flap and you had this little paper knife edge thing. And by the time you smooth it, so you had a nice 4 or 5 millimeter wide floor to work on, you basically had no room for the implant. So I guess they should just wait a couple of months before you release your implant before they answer that question, right? As far as what brand?
Well, the inventory, well, sure, yeah. Before a brand, obviously, I'd recommend my own. But really, any of the big implant manufacturers, they'll sell you an implant that works. So I would say just see what works best in your hands. What I would do actually is contact the reps, get them to send you a kit, and get them to send you a model, and practice with like 4 or 5 different kits, and just see what feels better, and see which company gives you the best attention or customer service. And to be honest, it varies with the rep that you have. So I don't know. All of them are going to sell you an implant that works. So just see what company you're comfortable working with. The company that we're building is actually a subscription-based company. So we're hoping to be with you for the long run, keeping you happy versus trying to sell you a big package.
And I want to tell you a couple things that we were talking about Jerry Niznik. And by the way, Jerry, thank you for your $1 million donation to the University of Manitoba Dental School. He's even though he lives in Palm Springs, he doesn't forget his Manitoba Canadian roots and gave them more cash than they were expecting. But what I loved about Niznik is this: when we started placing implants, you always had to order all these pieces, all these parts, and then in the middle of the surgery, you didn't have a CBCT, so you thought you were going to use, you know, an 18, and then you needed a 16, so you needed all this inventory and all these parts and all this stuff. And what Niznik did, he said, look, I'm going to put everything you need for the implant. Put the implant, the transfer coping, all of it in one little bag. He wasn't going to nickel and dime you. He was going to, here's one package of everything you need. Your assistant have to go back there and open all these trays and boxes and try to figure it all out. So packaging. Another thing I lived through, like Coke was getting massive sales and milk was dying. So the dairy farmers started putting all this money into advertising milk. Got milk, and they get Michael Jordan and all these good-looking athletes to show a milk mustache. Turns out, you know what beat that to death? Was when they repackaged the milk. The square milk carton didn't fit in your car holder, and they said, we ought to just make it kind of round like a Coke. And that blew away the packaging of milk to fit the car holder, blew away all their advertising campaigns, got milk and things like that. And the other thing about Mish and those guys, what they did was just packaging. They just made it easier. Do you understand kind of what I mean?
I totally understand what you mean. And I know what you're saying about what Jerry did with Implant Direct. And if he was still, I think, at the helm of Implant Direct, I think he would keep innovating within it, right? I don't know if there's that same innovation without him. One thing though, over time, with so many innovations, you get kind of a bloated catalog. And so that's sort of, even though there's all the convenience attached to it, what I want to have is a sort of more focused catalog, because my philosophy is always, I got it from this book called Story Brand. It's when you confuse, you lose, right? So I'm really trying to keep it ultra focused.
Yeah, and always explain it to a 5-year-old, because people think that's demeaning, but look, if you do transmissions and I do root canals, I don't know what I mean, I grew up with 5 sisters. I played Barbie dolls till I was 12. It was the most traumatic time. Mark Borland, my friend in the 6th grade from Blessed Sacrament, walked home with me on a Friday night. He was going to spend the night, and he walked in my room, and he saw all my Barbie dolls, and he said, man, if my sisters left their Barbie dolls in my room, I would punch them. And I'm like, those are my Barbie dolls, and I thought we were going to play Barbie all weekend. And I cried and had to give away all my Barbie dolls and all that kind of stuff. But the bottom line is, oh my God, I didn't even know where I was going to that. Is that when I go to the car dealership, they say, first time I went to the Lexus dealership, the guy asked me if I wanted 30 weight or 40 weight motor oil. I'm like, can I see your manager? I said, look, dude, I can dress a Barbie doll 30 different ways, but I was coming to you because I thought you knew the answer to that. If you need me to know the answer, can you give me a name of some place to go where they'll know the answer? Because I don't know the answer to that. So when you're storytelling, everybody is back in grammar school. They used to say, explain it as if they were in the 6th grade. No. Explain it like they're 5. The guy told me the other day that my lifters, I don't even know what a lifter is. I don't want to know. That's not what I do. But the other thing with the people that sell, we had a guy pass away at the beginning of this pandemic. In fact, it was Omar Reed. He taught me how to sell dentistry. And he said, here's what dentists say. Number 2 needs an MOD. Number 3 needs a crown. The assistant doesn't need a build-up. And, they go all through the teeth on the patient. They know what you're talking about. Omar says he just look in there, and I watched him do this so many times. He just look at him and say, what do you, come on, you got to help me. I mean, what do you want to do? I mean, obviously we could do this really low cost. We could remove all these teeth and we could do a full denture. He said we could just leave the teeth, fix the cavities, do fillings, probably $2,500. We could do a cleaning, exam, x-rays, fix up all your teeth. But to have like a little nicer, like 10 grand would make it really, really nice. And of course, obviously the Mercedes-Benz is the most expensive, but if you wanted to spend $25,000, I could give you a Mercedes-Benz Smile, but I need to know where you're at. And they would immediately tell you, money's king. I'm broke. Just do what's in pain. Or they might be in another place in their journey, say, hey, I want the Cadillac, and then he would just quote him 25 grand. And I said to Omar, I said, well, you don't even know what you're going to do yet. He goes, I got 25 grand. I'll figure it out later. You know what I mean? So, selling, Dennis, selling these cases is a lot harder. But hey, I want to ask you, go ahead.
That ballparking has been so useful for me. Like you just said, when you have a consultation in and you can ballpark fees right away, it's going to save you. It's going to save you 20 minutes. It's going to save you 30 minutes, or even longer if you're doing a thorough exam. Giving them ballpark fees really gets you to where you need to be, I think, to understanding the patient. But also, when you're presenting the treatments, I found that if I present the Cadillac first, and then I present the other treatments, so best, better, good, in that order, instead of good, better, best, then I get higher treatment case acceptance.
And I'll tell you what really pisses people off is when you say, "Oh, we're going to do a crown," and it's $1,000, and then they get up front to pay, and you added a buildup, and now it's $1,200, and it's not the $200. They had 1,000. They're mad, and here's where implant cases don't get sold. Real simple question. Well, doc, how much will that implant case? Well, I don't know, because when I go into place, I might have to do bone graft, and that could be this. I might have to do crown lengthening. I might have to give an extra carpal anesthetic. You might be in pain, and I add nitrous. I just have no idea what this is going to cost. Well, then just say you don't want to sell an implant case. You say ballpark. I don't care if it's a ballpark, as long as at my office in McDonald's, you go to McDonald's, you order a hamburger, you give them $1, and then they hand you the hamburger. When you come to my office, I say, we're going to do this, and it's going to be $1,000. And when it's over, it's $1,000. We don't say, oh, we added a buildup. Oh, well, you asked for nitrous, or you don't nickel and dime people because it pisses them off. I want to ask you this. When I got out of school, there were 9 specialties. Now there's 12. There's oral surgery, endo, perio, pediatric dentistry, ortho, pros, dental anesthesiologist, oral facial pain, oral med, oral path, oral radiology, dental public health. How the hell did we get 12 dental specialties and implantology is not even one of them? Does that make any sense to you?
Well, I don't know. Implants are being done by several specialties, and they all claim to be the implant specialty.
So you went to dental school at University of Pacific School of Dentistry, right?
Okay.
So was Nader your dean when you were there, or is he after?
No, he wasn't. He was after. Yeah, it was actually Farillo, and then Nader's the dean currently.
And do they get any implant? Does a kid coming out of University of Pacific, will he have placed a single implant in school? Is that common, uncommon? What's that like?
I actually didn't get to place an implant when I was in dental school, but I did get a lot of implant training because I volunteered myself to take all the implant cases from my classmates. So I was able to be in the OR, assist for implant procedures, and restore. But yeah, I mean, a couple of my classmates got lucky and were able to place 1 or 2. So that's the kind of experience that you would be getting if you're kind of following the curriculum, maybe getting your hands dirty with 1 case for surgery.
I want to ask you some controversial things. We've been over. Are you good for time, or do you need to get back?
I'm fine. Yeah,
because I'm in overtime now. I just wanted to go to the big controversies. Obviously you get the old guys, and I'm not talking about as old as me. I'm talking about as old as your uncle, Edwin. That's my God, The Walking Dead. They'll say, look, man, I placed every implant with a pano and I didn't have a surgical guide. Other people are saying you got to have CBT, it's all surgical guide. Some of the older guys say, yeah, but if you're going to become an implant surgeon and you're just going to put all these through surgical guides, well, when you have a complication, you know that someday you're going to have to lay a flap and fix this thing. So some people think that surgical guides are training wheels that keep you from taking off the training wheels and becoming an implant surgeon and laying a flap. Where do you draw? Obviously, it's a yin-yang deal, but where do you draw the line between a surgical guide is a crux and you never became a surgeon, or it's really helpful and you should do one? And I'm going to hold your feet to the fire. If you placed 100 implants, how many of them would use a surgical guide?
So I would recommend a surgical guide in 2 cases, right? So if you don't have very much experience with placing implants, you're placing very low volume. That makes sense to use a surgical guide because, well, you don't have a ton of experience, and a surgical guide will help you get that hopefully spot on. The other instance where it makes sense to use surgical guide is if you're placing a ton of implants and you're just too busy and you need to do it faster. But if you're somewhere in the middle, I think it makes a lot of sense to do most of your cases freehand, because with freehand you have more control, and you don't really need a guide, honestly, in a lot of cases.
I also want to add, I got my DIs, my Diploma International Congress on Implantology, but you know, that like say when I got the implant guide, my instructor was Fred Flintstone. That's how long ago it was. But looking back at the last 30 years, you know who made all the money in implants besides the manufacturers like Jerry Resnick? Did I say that right, Resnick? Um, you know who made all the money? When I graduated from the Mission Institute and got my diplomat and all that kind of stuff, the smart ones went back to South Carolina, Bakersfield, out here in Mesa, and they bought the true blue 30, 40-year-old denture world. That's always in the poor part of town. It's always where all the trailer parks are and the retirees. And there'd be this big brand that everybody goes to denture world when they need a reline. And that's why Aspen's doing so well. I really do think Bob Fontana might be the first. I think he's the only one that could do an IPO and go public. You know, Orthodontic Centers of America went public and when I was got out of school, it was the only one to this date that made on the New York Stock Exchange by Gaspar Lazar, and then imploded. And I think that left such a foul taste in everyone's mouth, they'll never go back. But the reason Aspen will go back is because they're targeting, they go where the dentist ain't. So they go to the places where there's not a bunch of dentists and everyone's on Medicaid. And there's so much money there. I'd rather own McDonald's than I would Ruth's Chris. But these boys were smart businessmen in my class, like, my God, Chip Castine out in Bakersfield, just a ton of them. And they would go back to this denture world, and they'd buy the denture clinic for, you know, $200,000 or $300,000, massive name brand, it'd be like Coca-Cola. And then when everybody's come back from the reline, you know, they bought it and they got their diplomat and implants. They'd say, well, yeah, we can do a reline. And the whole bait and switch deal of the denture, it's not even a bait and switch. It's like you have a low cost, a medium cost, and a high cost. I mean, if you go to the muffler shop, they have basic, premium, and supreme. So here's the low cost denture, and say it's full mouth, say it's $4.99 for a full set. And then the next one's $7.50, but you know Ivoclar makes special denture teeth that are more expensive. They have that. And then they would have, if you're in Australia, the lowest cost is one implant right down the middle. I only see them do this in Australia and New Zealand. They put one down the middle. The American version is just two, and that's either two on balls or two on a bar. And so they'd say, okay, so we can reline it. We can make a low-cost denture, a medium, high-cost denture, or a denture on one implant, or one on two, or one on four. So in 1 minute, they say we can do this from $199 to $19,999. Ivan, where are you? Are you thinking $199 or $19,999? And my God, they would convert about 10% of those relines to implant cases. And I mean, these were guys that bought a denture clinic that for $300,000 that never did $400,000 in collections, and they were doing $3 to $5 million a year after they bought them for 30 years. That is the business model from hell for implants. So I suggest that you first find the Denture Ninja, and then go find the Implant Ninja and learn how to upgrade an all-on none to an all-on four. Because the bottom, it's the same thing with selling cars. My dad, one time I thought I had the Saturday off, and he came and woke me up and told me he had great news. He got me, his friend that owns a car dealership is training this class of salesmen all weekend, and he promised them that if he brought his little Howie there, that Howie swears to God he won't say a word, he's just going to sit in the back, but he wants to hear this. But I cried all the way there, but I sat through it. But it was the same thing. It was like, selling, just make it simple. When someone says, how much does the car cost? Give them a number. Don't talk for 28 minutes. Give them a damn number. But I would go buy, I think the biggest implant practice I've ever seen were adding implants to a denture clinic. That is just big money.
I think it's super relevant to recent grads too, that you should think of the business model that you're going to grow into. The average dental practice is that's just it. It's an average dental practice. But if you think of a business model that might work well in your niche, you'll do better than, obviously better than average, but you'll be able to capitalize on some cool opportunities.
And you're a prosthodontist, and I got to tell you the weirdest story about a prosthodontist. My oldest sister is a cloistered Carmelite monk longer than I've been a dentist. And so when I started my own magazine, I put her on the list, and she saw the word prosthodontist for the first time, and she had to ask me, what's that about? And I said, well, why do you ask? She goes, well, prostitute, prosto, artificial, toot, love, prosthodontist, artificial, odonto, tooth. Is it artificial love of tooth? What is this prosthodontist that you're talking about? So first of all, I got to ask you, is your artificial love for tooth what made you a prosthodontist? I don't even know if that makes sense.
I applied to Prost because I asked Dr. Edmund Bedrosian, who was one of my mentors back in dental school, how do I become the best implantologist I possibly can? And he said, treatment planning is king. You got to do Prost. And so that kind of persuaded me.
So there's 3,500 prosthodontists in the United States of America. There's a quarter of our viewers are still in dental kindergarten school. If somebody's in dental kindergarten school and she's thinking, when I graduate, I want to go to prosto school, good idea or bad idea?
It's like, should I specialize or should I not specialize? I get that question all the time, and you can learn a lot of stuff online. You can learn a lot of stuff in CE. If you want to learn something, you can learn it from CE, no problem. Pick up one or two skills, or whatever. If it's skill specific, you can pick it up in CE. But if you want to, take 3 years out of your life to put on pause to really learn a comprehensive discipline, then I would say it does make sense to specialize, whether it's prosto or perio or whatever. Really taking that time just in a safe zone and safe learning environment to level up, I think it makes sense. But it just depends what your goal is. If your goal is to place an implant, don't become a prosthodontist. If your goal is that I want to do a full arch case, don't become a prosthodontist. Just learn that in CE. But if you want to, do everything that a prosthodontist does, then it makes sense to do that.
And the big problem with the $1 million question I see, the other deal is 1 + 1 = 3. I'll try to wrap this up. I know you're probably thinking, he said it's an hour and this guy will not shut up. I'm sorry, I won't shut up. But you're so fascinating. But 1 + 1 = 3, and the whole is greater than the sum of its parts. We're seeing now that if 100 moms took their kid to a pediatric dentist, well, every mom's going to say, well, my child need braces when they grow up. So now the new pediatric dentists are opening up with the orthodontist, so it's all under one roof. It's the deal of retail is one-stop shop. We saw with Clear Choice, we're going to take the surgeon, the prosthodontist restoring it, the lab tech making it. We're going to put it all under one roof. That's 1 + 1 + 1 = 5. That they're doing about 18,000 arches a year for 25,000 arch. It's been bought and sold 5 times. And with individual prosthodontists, what I see is you either learn how to place the implants, but that will be a channel conflict with your referrals who just wanted you to restore them. And if you are a prosthodontist and don't restore implants, then you're not a threat to oral surgeons and periodontists and all this kind of stuff. So how do you recommend prosthodontists get their mind around, do you want to be a surgeon and place them or just restore them? Because it's going to have a lot of channel flick complications.
So that's choosing your career based off of, so I would say do what makes you happy, right? Do what makes you happy. If you like to do surgery and like to do restorative, that it makes sense to learn both, right? I wouldn't pigeonhole what you like to do just because, you've got some plan for your referral network or something. But basically you're asking if you want to practice as a specialist or as an implant center, right? If you want to practice as a specialist, all the specialists got to play nice. If you want to grow your referral, your referral network. But when I came to town, I did full arch surgery and restorative, and I got a lot of referrals for it because I was the only person in town that was really doing that. As a prosthodontist for sure, but in general, I was pretty much one of the only people that was doing that. So I think you can be successful either way. The specialist route, it's sort of already built in. It's sort of like organic and it's tried and true. You'll grow more slowly. But if you've got kind of an entrepreneurial mindset and you think you can build out a niche for yourself, I think that works really well too. It just depends how much I guess work you're going to put into it.
My gosh, I'm trying to think of what I know the minute I let you go. I'm gonna think. Oh, what was the trefoil all-on-3? We talked about all-on-4s. What is the trefoil all-on-3? And then I want you to comment also. We gone from all-on-4 to all-on-3, but before we get to all-on-none, a denture. What do you think about the all-on-1 right down the semicolon? When I was in Australia, people say, well, when you put 2, you're making a line and a fulcrum, and one on the symphysis right in the middle on a ball is more. But tell us about what is the all-on-3 and what do you think about the all-on-1?
You actually see a lot. You actually see a big, I guess, a big range, right? You see all-on-6 fixed, all-on-4 fixed. Trefoil is an all-on-3 concept by Nobel. That's their own proprietary method that includes like prefabricated bar, prefabricated parts. So that's the all-on-3 fixed. And in Europe, what they're doing is all-on-2 fixed as well. There's a guy out in Italy, Cannizaro, who's placing 2 implants sort of angled, right, angled away from each other a little bit with a titanium bar and using that for a fixed full arch. And I've even seen one implant that's fixed full arch. So I don't know. Yeah, there's a whole range. Right now, what's currently accepted is all-on-4, and now Nobel's pushing their all-on-3. If you did an all-on-3 and then it failed, I'm sure that the patient would question that and question, its acceptance. So even though I'm sure all-on-3 works, right? And Canizaro is showing that all-on-2 works as well. So I don't know. I think we can't be dogmatic about things. We got to see really what works and what works in our hands, and try some things for ourselves. But the climate is kind of scary because we're afraid of getting sued. We're afraid of having the dental board contact us.
The first time the dental board contacted me, I think I scared them so bad. I think they were afraid of me.
Howard, I was interviewed by somebody from the dental board. This guy's got like a gun and a badge. I didn't know the dental board is like that. They're hardcore.
Oh my God, they sent me a letter, and it's always the guy across the street ratting you out. You know who it is. It's the one that you don't drink with, it's a weirdo. And I guess there's a law that you can only have 2 hygienists, so I got a letter from the board, this in like 87, 88, that says that I have 3 full-time hygienists. I'm only allowed to have 2. And I said, well, then what you need to do is you need to come down here and go through all my charts and find out which patients no longer need care and which of my 3 hygienists I will fire. And I, this before email and internet, so I wrote him the letter, but I CC'd the Arizona governor, Senator McCain, the President of the United States, I think it was Ronald Reagan. I mean, I sent this letter to like 40 different people of all the news stations everywhere. And I swear to God, I never heard from those idiots again. I don't believe in the board because I think they're immoral and they're corrupt and I think they're evil. And what I mean by that is what they do is there's no dentist in the Guadalupe Indian Reservation because they're all Guadalupe Indians, and there's about 20,000 illegal Mexicans that live there. And every once in a while, some really great dentists from Mexico will sneak into the United States and go to this city where they have 25,000 people and there's not one dentist, and they'll set up a dental office. So what does the board do? They go and arrest them and kidnap him and put him in a cage and expel him and all this stuff like that. So the dental board are the people that keeps the healthcare racket going. There was never a problem paying for health insurance until 1900 when all 50 states created the State Board of Dental and Medical Examiners that said, it's like the FDA. The FDA says, well, this drug isn't approved for cancer. Okay, well, I have that cancer and I'm going to die. I want you to try it on me. Oh, no, right now it's only available for rats and monkeys and mice. The lady I bought my mansion from, and there was a pharmaceutical company that made a drug for her brain cancer. She couldn't get on the study. She couldn't get the medication, but they were already selling it in Denmark, Scandinavia, Sweden, Austria. So she sold her house to me and had to move to Austria because your government's best idea is that, well, we haven't approved it. So what elitist assholes do is they take away your options. They always have like 5 options and they take away your 1. So here's the Dental Board of Arizona, which I think they should be removed from office because they're saying, okay, Guadalupe does not have a dentist. So you're saying a dentist from Mexico coming up and working on Mexicans who are born in Mexico? That's somehow illegal in your twisted walnut brain of a mind? What the board should say is, we don't recommend Howard. Yeah, every time we go in there, he's got a beer in one hand, and we do not recommend Howard Ferran. Okay, but if I want to go to Howard Ferran, that's my right of freedom, and they are always taking away freedoms. And whenever I see them, I always correct their stories. Like on Twitter, they'll say, "Dentist arrested in Florida for doing dentistry illegally without a license." So I'm like, okay, well, let me fix that for you. Dentist from Russia who graduated from Moscow University School of Dentistry is arrested because she was doing dentistry on Russians who don't speak English and didn't have her proper paperwork in order, you Nazis. I mean, don't get me going on government. I hate government so much. And by the way, if you're a Republican or a Democrat and you like your team more than the other one, I hate them both equally. One robbed the bank, one drove the getaway car. Now I'm so mad I forgot what my next question was, but I know I had one. And then I'll let you go. Here's my rant. Then I'm gonna let this guy go free. You know what street smart people do? Street smart people, they keep one eye on their dollar and one eye on the customer, one eye on cost. They always understand their cost. And dentists, there's two types of dentists out there. There's street smart dentists who are millionaires, and there's just dentists that aren't street smart. For instance, they want to learn occlusion. So what do? They hop on an airplane, fly halfway across the world, and drop $3,000 on a weekend course. And they come back to me. I'm sitting there with them at lunch. I say, here, do a shot, drink a beer, and just tell me everything you learned that you didn't know. And they struggle to tell me like one or two things. I'm like, you paid $3,600 for that? You want to learn how to place implants. I mean, he's got everything online. I mean, you can learn this so much. The cost of dental education is absurd. My gosh. I mean, go to implantninja.com. He's got the deep dive. He's got the self-space online courses. Talk about what they can learn online without having to get in an airplane and fly across the country and stay in a resort.
Well, if you're trying to place your first implant, or you're just trying to get better at or more comfortable at placing implants, our online course will teach you to do just that. Take you from knowing nothing to placing your first implant. That's it. That's the basics of it. It's everything. Treatment planning, surgery videos. You can actually buy a model and do it alongside with me, right? So I can actually do the surgery here in my benchtop, and you do it in your office, and I'll guide you through it. So everything from not knowing to placing, I'll walk you through it.
So you kind of divide it up between deep dive and traditional.
Yep.
And they're both step-by-step instructional video. So how many videos do you have? How deep does this rabbit hole go?
Yes. So the self-paced courses are truly just do at your own pace. Once you buy it, you're in. We're in touch with you, and we still answer your questions, but you do it at your own pace. But some people want a more personalized instruction, right? Some people are not, they're not happy with just learning on their own online. They need a little bit of motivation. So those are people who would like the deep dive instead. So the deep dive is the course, right? So the same course as a traditional course, except for we connect over a 6-week period. We'll meet 6 times. And I actually go over the curriculum with you in our small cohort. It's usually like a class of like 10 people. And we'll go over it together. And we'll actually do benchtop work together. So a benchtop workshop. And I'll actually have you on one of my live surgeries. So I'll do a live surgery with the camera way up in the patient's mouth, and you'll be in my earpiece, and I'll walk you through it. And I can, you can ask questions during, or I can slow down or whatever. So it's just a more comprehensive, personalized way to learn. And I actually enjoy that a lot more because I love to connect with my students too, right? I love to talk with them and treatment plan their cases and whatnot.
Well, I mean, so what is this? What is this going to cost? So you're saying it's a 6-week program, once a week for 6 weeks?
Yep.
And how much does that cost?
The deep dive is $2,500.
So just your first single implant case, root canal. So you're saying I have to, for the cost of just one implant and a crown, they can learn how to do it.
That's right. Yep. And if you are just looking for a self-paced way to do it, the traditional courses are $1,000. So it's a little bit more economical. That's our most popular by far. But I don't know. I have fun with both of them.
Well, you've had over 1,000 doctors around the world do this. I've heard of you so many ways. If you ever think it's a good marketing thing, Dentaltown has put up 400 one-hour courses. They've been viewed over 1 million times. You might want to do a 1 hour the Pankey Institute did it and Dawson did it, where they were trying to sell these week-long curriculums. You're like, well, how do you go from a full-page ad to spending a week in Key Biscayne? So they made a 1 hour course of each one of their weeks, and they said it was the best marketing they've done. If you think I want my homies to do it faster, easier, higher quality, lower cost, better. Why would you want to learn something for $3,600 in a weekend course if you could have done it for $360? I mean, it makes common sense. But if it ever makes sense to you for marketing to put up an online C course, I'm Howard at Dentaltown. The guy in charge of online C is Howard Goldstein, so he's Hogo at Dentaltown. But you could put up one of those courses, then say at the end of the course, say, for 50 more videos just like this, go to Implant Ninja or whatever. But all I want to tell you is be street smart, man. Be street smart. I know when you come out of school, everybody wants to go do full mouth veneers on movie stars in Scottsdale and Beverly Hills, and then it takes you about 4 years to find out that you're in Parsons, Kansas, and there's no movie stars that want to do, you're going to make a hell of a lot more money selling F-150 pickup trucks than you are on Mercedes-Benzes. As far as what you should learn, well, what are you treating? I mean, if you get, it's like dentists will call me up and say, well, Howard, do you think I should take Blue Cross Blue Shield? Dude, what is your getting to yes page? Whenever someone asks for something and we say no, we write that down. We have a prescription pad called Getting to Yes, and we write down, oh my gosh, it was Saturday morning at 8 o'clock, and this guy named Ivan Chicchon called, and he wanted to know if we're open on Saturday. Well, you're not open on Saturday. Well, is someone asking you that one time a week, one time a month, or 3 times a day? And so, when you're asking me, well, should I learn how to place implants? Well, I don't know. Are you seeing lots of dentures and partials removable? Are you seeing that? If you get asked 5 times a day if you do Invisalign and no one's ever asked you about an implant, then I would go off into the Invisalign world. But, business in 3 words is supply and demand. And what I recommend is all the big money is in clear aligners and implants. I mean, that is where all the growth is, from Kansas to Kathmandu. And when you look at the fact that 8.5% of all emergency room visits in the United States are odontogenic in origin, when someone says, well, a dentist isn't a real doctor, I agree. Real doctors don't have 8.5% of their patients end up in an emergency room because you're unlisted, you're closed Friday, Saturday, and Sunday, and they don't know what to do. I mean, I just think that's sad. I think the dentists that hustle, like me, hell, I give all my patients my cell phone. And you know what? And they'll say, yeah, but what do they call you at night? Well, if one of your patients calls you at night, you probably want to take that phone call. It's probably not inviting you to a birthday party. It's probably something, and they need to talk about. And with my patients, granted, 90% of the questions are dumb. Like, my most common questions is, Dr. Fran, those antibiotics you gave me, am I supposed to take them? No, they're suppositories for your cat. Go get your cat right now. I want to stay on the phone to make sure you insert them right. But just get out there, work hard, and hustle. And I know the number one problem you're going to have is the same problem you always have, and it's just fear. And it's just fear. It's blood and guts. And I remember one of my best friends in dental school, when he saw his first extraction, he passed out and hit the floor and chipped his front incisor. But now he's one of the best doctors in the world. But the first time's scary. The first 10 or 100 implants might be scary, but you know why you're scared? Because you haven't done 10,000 of them. So just put your nose to the grindstone, and you're either going to go blood and guts. And I can tell by looking at your first root canal where you're going, because a real doctor's blood and guts, and when they do a root canal, there's a puff of sealer out the apex because they're apical barbarians. But if you stop a 0.5 millimeter short because you're trying to preserve the little end of the tooth, then you need to go into bleaching, bonding, and veneers, and all that pretty white stuff. So if you're a blood and guts apical barbarian, you like sealer at the apex, man, learn how to pull a tooth, learn how to place an implant, and there are dentists out there. My final question: some people think that extracting an impacted wisdom tooth is harder than placing an implant.
Are you asking me?
Yeah.
Yeah, it's true. Well, I don't know. I placing an implant, it can become bread and butter for most people. Honestly, it's really can be slam dunk.
Okay, so final close. Tell them why they need to go to your website right now and sign up at implantninja.com.
Well, our place really is, Howard, the best place you can learn dental implants online. Super easy, super user friendly, straightforward. We'll get you to placing your first or to level up to full arch. So happy to see you there. I'm really excited to any of your listeners that want to join me. I'm happy to see them on the other side.
Okay, and do you give out any contact information, or just the website? Is that good enough? Just implantninja.com, or do you give out your email or any of that? Or
sure, implantninja.com, and the email is implantninja@gmail.com. Super
all
easy.
right, man. Hey, thanks for all you do, and I know you're busier than a one-armed dentist. Thank you so much for making the time to come on the show.
Thanks, Howard.
All right, have a great day, buddy.